Hey everyone, this is Dr. Medicine RX, and in today's video we'll be discussing about zinc deficiency. So zinc is an essential trace element, and its deficiency in infants presents as Acrodermatitis enteropathica or transient neonatal zinc deficiency, whereas in other ages it causes acquired zinc deficiency. Coming to the sources of zinc, seafood, liver, eggs, meat, legumes, green leafy vegetables, nuts and whole grains are some of the important sources of zinc. Coming to Acrodermatitis enteropathica, it is the deficiency, one of the manifestations of deficiency of zinc in neonates. So coming to the pathophysiology, Acrodermatitis enteropathica is an autosomal recessive disorder that occurs as a result of mutation in the intestinal zinc transporter gene. This gene, it encodes for ZTP4, which is zinc transporter, present on enterocytes. This zinc transporter, it is required for the intestinal absorption of zinc. Premature infants are especially at higher risk for AE because of their increased metabolic demands, because of inadequate stores, immature gut epithelium, and greater zinc losses through urinary, fecal, and cutaneous routes. Clinical features, it presents during the period of weaning, where the infant is weaned from breast milk to formula or cereal, that is between the 4th to 10th month of age. And the classical features are alopecia, diarrhea, and periorificial and acral cutaneous eruption. So the child is lethargic and apathetic. And coming to the cutaneous manifestations, there is going to be an acute eczematous and erosive dermatitis, that is periocular, perioral, anogenital in location, and it can also occur in the hands and feet, that is in the acral areas. The perioral eczema, it usually spares the upper lip, giving the U or horseshoe shaped appearance. Coming to its distribution, it is bilaterally symmetrical, and it can also occur in the form of plaques, bullae, and erosions, where bullae and erosions can later on cause crusting. And because of this, there can also be superinfection, especially with Staphylococcus aureus and Candida species. The hair is dry and brittle, so it breaks easily, causing alopecia. And some of the other features include angular cheilitis, paronychia, delayed wound healing, and vitiligo-like hypopigmentation. Whereas some of the eye manifestations include conjunctivitis, blepharitis, and photophobia. Now, as a result of chronic deficiency in these infants, there can be psoriasiform dermatitis, growth retardation, hypogonadism, dysgeusia, and abnormal dark adaptation time. Some of the differentials for this presentation is seborrheic dermatitis, psoriasis, kwashiorkor, biotin deficiency, and irritant dermatitis. Coming to investigations, so the plasma zinc level, it will be less than 70 micrograms per deciliter, and serum alkaline phosphatase, which is a zinc dependent enzyme, can also be calculated. Its levels can be calculated. Sometimes there can be accompanying hypoalbuminemia. And for marginal zinc deficiency, zinc in granulocyte and lymphocyte calculation is to be done. And on histopathological examination, there is going to be psoriasiform hyperplasia, confluent parakeratosis, spongiosis, and focal dyskeratosis. Coming to the treatment, the RDA value, that is the dietary allowance value for children to 3 years of age group is 2 to 3 milligrams per day, whereas 4 years to 8 years is 5 milligrams per day. 9 years to 14 years is 8 milligrams per day, and for adolescents and adults is 8 to 13 milligrams per day. So for enteral supplementation, we use zinc sulfate, and for parenteral supplementation, we go for zinc chloride. So in patients with Acrodermatitis enteropathica, because there is a gene defect, lifelong supplementation of elemental zinc is necessary. So because it typically presents in neonates, we have to start at 3 mg per kg per day of elemental zinc. Other supplementations with diiodohydroxyquinoline, human milk, and essential fatty acids can also be beneficial. Coming to acquired zinc deficiency, it is seen in other age groups where there is a deficiency of zinc not related to any gene mutation. So coming to the etiology, it can be because of decreased intake, such as in early weaning, or in eating disorders, alcoholism, vegetarianism, or total parenteral nutrition that is deficient in zinc, or when there is decreased absorption in case of inflammatory bowel disease, celiac disease, chronic diarrhea, short bowel syndrome, and gastric bypass surgery, with celiac disease and chronic diarrhea causing increased losses. and increased elimination in cases of alcoholism, malignancies, burns, infections, pregnancy, and dialysis. And certain systemic disorders such as cirrhosis, diabetes mellitus, chronic renal failure, connective tissue diseases, and HIV can also predispose to zinc deficiency. Certain drugs such as penicillamines, diuretics, and oral contraceptive pills can also be responsible. Coming to the clinical features, so in acute deficiency of zinc, there can be palmoplantar periorificial anogenital dermatitis and angular stomatitis. So flat grayish vesiculobullous lesions that are surrounded by reddish brown erythema can be seen on the palmar and finger creases, and sometimes these lesions can become black and necrotic. There can be diffuse progressive thinning of scalp hair which causes total alopecia in few weeks, and septicemia, photophobia, and depression are some of the manifestations. Oozing lesions can occur in bedridden patients. In cases of chronic deficiency, so the usual perioral anogenital areas are affected. There's going to be pearl leg glossitis and stomatitis. Similar eczematous, vesiculobullous, pustular, erosive crusted lesions can occur. In chronic cases, well demarcated, thickened brownish patches also occur over the pressure points, such as the joints, and there can be hair growth which is poor and sparse, along with broken spear-like endings. The nail shows dystrophy, boss lines, transverse bands, and paronychia. The involvement of nail is characteristic of chronic deficiency, and necrolytic migratory erythema is also seen in cirrhotic cases. So coming to some other features, there can be growth retardation, there is lack of secondary sexual characters, there is decreased spermatogenesis and abnormal oogenesis. In pregnant women, there is increased risk of morbidity and prolonged gestation with inefficient labor and increased fetal risk, and the fetus may even have congenital malformations. Cell-mediated immunity and humoral immunity are impaired, leading to increased susceptibility of infections. There can be delayed wound healing, and CNS manifestations such as instability, emotional liability, schizoid behavior, tremors, and ataxia can also occur, and there is going to be reduced night vision. Coming to management, 0.5 to 1 mg per kg per day of elemental zinc in children and 15 to 30 milligrams per day of elemental zinc in adult ought to be supplemented. And if intestinal malabsorption is present, then high doses of zinc supplementation or parenteral route can be preferred. Thank you. Subscribe for more.